This morning I'm talking with Elizabeth Joy as part of the Distinguished Leaders in Sports Medicine and Exercise Science series. So Liz, thank you for joining
my
us
pleasure.
and talking. I just wanted to start out, if we could, a little bit of your early education, where you grew up, where you went to high school, college, were you involved in sports, were you physically active then, those sorts of things, and then we'll move in and talk a little bit more about ACSM.
Well, my interest in sports, comes and starts at a very young age. I was, I think, a very active child, a three-sport high school athlete.
Oh, wow.
And then played volleyball in college.
Where did you do your high school, or what part of the country?
I come from St. Paul, Minnesota.
Okay.
So I'm a Minnesota girl. And
no ice hockey?
My brothers, of course, played hockey. I figure skated a lot. And when I was, I think, a sophomore in high school, my mother said to me, make a choice, high school sports or skating, but you can't do both.
Yeah, because ice skating is sort of outside of education.
Absolutely.
Clubs and
that's right. It was outside of the school setting.
yes.
And
yeah.
so I think she was mostly tired of driving me around to ice rinks.
Different rinks,
After I got done with basketball practice. But I'm a tall girl, and at 5'10", volleyball and basketball came a little bit more naturally
that
to
would have
me
been fun, yeah.
than figure skating.
What was the third sport?
I was a runner.
Oh, okay.
So, and I did try in college to play volleyball and run, but running distance, I was a miler in high school and college, doesn't do much for your vertical jump.
Mm-hmm.
And I thought, I can play college volleyball once in my life, and I'll be able to run forever.
Yeah, good. Yeah, that's the way to look at it.
Yeah.
Now, where did you go to college?
I went to college at the University of Minnesota, and I was going to be a veterinarian since about the age of 6. And my senior year in college, I decided that I didn't want to be a vet anymore. And even though I had put in all these kind of volunteer hours, and it's in some respects, it's probably harder to get into veterinary school than it is to medical school because there are fewer of them.
Absolutely. Yeah.
And but I'd had my fair share of injuries as a college athlete, and the doctor who took care of me was a family physician at the student health clinic at University of Minnesota, and he was such a kind man, and he really cared about me as a person, and he was there regardless of the type of injury I had, and was so invested in us that at some point I thought, I want to be like Dr. Hallen. That's who I want to be.
That's neat.
And so
what time period was that, Liz?
Well, it was my senior year in college.
So what would be the date?
So that would be in kind of the mid-'80s.
Okay.
Yeah.
Okay.
And
so you didn't have a team physician as such?
Not so much. Not necessarily assigned to the volleyball team, but he looked after the female athletes at the University
That's what
of
I
Minnesota.
was trying to get. Yeah. Okay.
Yeah. And he, was a huge influence on me, and so with that, I decided to go to medical school, and went to medical school thinking I want to be like Dr. Hallen, and
yeah.
He wasn't a sports medicine doctor.
Sure, he was
he was just a
nice
doctor, a nice doctor who
cared
exactly.
Yeah.
And which is how I ended up in doing a family medicine residency program. Was that I really did like everything, and I wanted to be like Dr. Hallen.
Yeah. And that gives you that opportunity
Absolutely.
to do a little this. So back to your undergrad days, if you wanted to go to vet school, then you already had the prereqs.
Exactly.
For med school,
Right.
so you were okay.
I was.
There.
Yep.
And where did you go to med school?
I went to medical school at the University of Minnesota as well.
Oh, okay.
Yeah, stayed home and had a great experience there. And for residency training, I stayed in Minneapolis again and went to Hennepin County Medical Center, trained with Rob Johnson, who is one of my mentors. And I wanted to have that county experience. And it was a great training. The foundation it gave me was exceptional.
Quick question. So was that residency just in family medicine, or was there a sports medicine component?
Well, there's definitely a sports medicine component because there's a sports medicine fellowship
Is
based
that,
out of Hennepin County.
did you have that then?
Yes.
Okay.
Yep.
Okay.
So when I
okay.
finished my residency training, you know, I had the opportunity during residency to integrate a great deal of sports medicine
Okay.
into my training.
Okay.
But then I went on to do a one-year sports medicine fellowship with Rob Johnson at Hennepin County.
Okay.
So-
Okay. And this was a total of what? 3 years?
So
4
that's
years?
4 years.
4 years.
4 years
yeah.
total of residency.
Was
and
Alan
fellowship.
Ryan there then?
No.
Because he was in Minneapolis.
He
thought he
was.
was the editor of Physician in Sports Medicine.
Exactly,
And I
before
wondered if
Richard
you-
Strauss.
Yeah,
Yeah.
if you crossed paths with him.
You know, we didn't cross paths professionally at that level, but of course I was, you know, knew him and as he was editor of Physician in Sports Medicine.
Yeah. So, so you finish all that. What's
Mm-hmm.
the next stop?
Well, I finished my training and then I went into practice
In Minneapolis?
in the Twin Cities,
yeah,
in White Bear
St.
Lake
Paul,
with
yeah.
Bill Roberts.
Oh, wow! I
Right.
didn't know that.
Yeah, so Bill recruited me into his practice
Oh,
when I finished my fellowship, where I did family medicine, sports medicine, delivered babies. You know, really had
Wow.
that full spectrum of practice.
you were doing what you wanted to do.
Exactly. And
How nice.
I worked with Bill for 3 years before I moved out to Utah.
So that may have answered my next question. When did you get involved with ACSM? Was it through Bill or earlier?
Actually, I got involved with ACSM when I was a resident.
Oh, okay.
And I went to my first team physician course meeting when I was a second-year resident.
Wow.
And did the second team physician course as a third-year resident.
Gee.
And,
neat.
and then I think was faculty in the team physician course, you know, very shortly out of my training.
Was Bergfeld and Lombardo involved then, or had they sort of gone from the team physician?
John Bergfeld was still involved when I was attending,
Uh-huh.
and by the time I was faculty in the team physician course, you know, Bill Roberts had kind of taken the reins of
Okay,
that.
okay.
So, you know, Bill certainly was instrumental in kind of getting me more involved in the American College of Sports Medicine.
And what was the time period then when you went to your first team physician's course?
I went to my first team physician course probably in the winter of 1986. No, wait,
Okay.
yeah, winter, no, not 86. I have to think about this for a second. I was in college from 79 to 84, med school 84 to 88, 88, 89, 89, so 90.
Okay,
1990,
okay.
So February of 1990 was probably,
So this is pretty early on for that course, really. I mean,
Yes.
it hadn't been going that
no,
long. So.
no, it wasn't.
And then you became faculty and how long did you stay with?
I probably taught at the team physician course for 5 or 6 years. Yeah, at least
And
that
that's
long.
been, you know, looking at it from the outside, just a wonderful thing that ACSM did.
Oh yeah, it was a great way to kind of spread the message, you know, that you could integrate sports medicine, you know, into your practice, you know,
Yes,
regardless
yeah.
of your discipline.
Mm-hmm.
I think that, you know, initially, because fellowships, you know, there's so many more sports medicine fellowships now.
Yeah.
There's so many more opportunities for people to, you know, do that training after they finish residency. Whereas, I think when the team physician course first started, I mean, there just weren't that many opportunities.
I remember sitting talking to Rosemary Agostini a
Yes.
few years ago, and
Yeah.
she was explaining like there was 1 or 2, or
Right.
and
Yeah.
she went to Cleveland Clinic, I think, actually with Bergfeld.
Yep, she
I
did.
think.
Yep.
So yeah, that was a big change. I mean,
Yeah, it was.
significant change.
And so when I went to Utah, I actually started a sports medicine training program at the University of Utah.
And so you were at Minneapolis, St. Paul 3 years, you said, at Bill's clinic.
Yes.
And what year then did you go to Salt Lake?
I moved to Salt Lake in '95.
Okay, and that's where you still are, of
Yes.
course.
Yep.
then. Okay.
Yep.
Okay.
And I moved to Salt Lake because Bill Roberts introduced me to my husband.
Oh, gee. So we have to give Bill a lot of credit here.
Bill
don't
takes a lot of credit, don't worry.
we don't need to pump up his ego anymore.
Yeah,
right?
no, he's he takes plenty of credit for that.
So what was it like when you got there? Did you start new things there, or what? Now, is your husband an MD too, or
Yes,
what?
My husband's Jim McIntyre, and he's a
Okay.
sports medicine physician as well. Very
Oh.
involved in the college.
Oh, okay, I didn't know that.
Yeah,
Okay.
and in fact was one of the directors of the advanced team physician course for ACSM for many years.
Okay.
Um,
Now,
but
so you both went there at the same time?
no, he was in Salt Lake.
Oh, that's right, because he introduced you to him.
Yes,
Okay,
yeah,
got
he's
it.
Canadian and had moved down to Salt Lake from University of British Columbia,
Okay.
and was friends with Bill. So that's how we met.
Can't be that bad, right?
Yeah.
Yeah, so what was going on there when you got there, and what have you changed?
So what I did when I got there was join another private practice, group to do family medicine, sports medicine, and stayed there for kind of a short time, about a year and a half. And then the university offered me a position on the faculty in family medicine to come and expand their capacity in sports medicine education.
Wow.
So I kind of jumped ship pretty quickly
Yeah.
up to the university and worked in the family medicine residency for many years, and was started the sports medicine fellowship program at the university.
Oh, nice.
And was the fellowship director there, and became increasingly interested in public health. And I love taking care of athletes and kind of doing clinical sports medicine. But I really started to consider, how do we get, most people don't move. The athletes, they move a lot.
Right.
And they need people who are really interested in caring for them and making them successful. I started to think, how do I get everybody else moving, and how do family physicians and medicine in general become more involved in physical activity promotion, and felt that in order to really make a difference, I needed to have a better understanding of public health. So I went and got my master's in public health.
Oh, an M.P.H.
Yeah.
At Utah?
I did that at Utah.
Yeah.
And then kind of shifted into doing more public health, shifted into the Division of Public Health at the University of Utah.
These are big changes.
Yeah, they were big changes. And started to do more research and maybe a little bit less clinical care. And then recently, I actually, although I have not left the university, but Intermountain Healthcare has hired me to be the medical director of clinical outcomes research.
Oh, wow.
And so I'm now working with this very large integrated healthcare system to now increase their capacity to do clinical outcomes research.
That's exciting.
It's
Yeah.
really
So you have a
exciting.
big population there to work
Huge.
with for epidemiology.
That's right, for doing clinical epidemiology, for looking at research in health services delivery, looking at clinical outcomes, looking at cost effectiveness. Intermountain Healthcare covers about 60% of the lives in Utah.
Rosemary just told me you probably talked to her what
Yeah.
she's doing with Group Health Cooperative in
Exactly.
Seattle.
And we're doing something very similar to that
Yeah.
within Intermountain.
Yeah.
In terms of really trying to integrate a wellness approach to improving
Very
population
nice.
health, and certainly, in our effort to try and improve the health of the population, so as to lower cost, improve quality of life, all those
All
things.
the right things
Right.
that we know are right.
Right. I think we really need to be very proactive in our approach to healthcare and not be quite as reactive. And by that I mean we want to, have a very systematic process to improve health rather than just react and prescribe medication once the horse is out of the barn.
Yeah, and I think that you would agree. Of course, this whole exercise medicine thing is a good thing, and it's
Yes.
coming at a good time. And you probably know this better than I, but I'm pretty sure I remember seeing the research shows that if their physician prescribes something, it's almost like 70% of the patients would say, "Yes, I'll do it."
Well, certainly, if the physicians say nothing, the patient,
It's not important.
That's
they
right.
think.
That's
So,
right. As my father-in-law would say, to permit is to promote. And if we're not talking about the importance of healthy lifestyle and physical activity in particular, then certainly the patient's going to think that that's not important. One of the things that I often ask is, when you last went to the doctor's office, were you weighed?
Right.
Yeah, yeah. Did they assess your blood pressure? Well,
So
yeah.
vital signs.
Yeah,
Yeah.
right.
Yeah.
I said, did they ask you about your physical activity?
No.
You know, and 9 times out of 10, the answer is no.
Right.
And I recently asked that question to the audience, you know, giving a talk here on office-based physical activity promotion. And sure enough, you know, the response is predictable.
Yeah.
So we need to have tools, you know, we need to have systems, we need a culture change.
Yeah.
You know,
absolutely.
so that we integrate that messaging into healthcare in a way that, you know, physicians are promoting physical activity.
Mm-hmm.
You know, many of them are prescribing exercise, and they are certainly advocates to try and reduce sedentary time.
Yeah.
I mean, I really think that's the scope of our responsibility.
And I think this whole movement now that, you know, thanks to people like Steve Blair and so forth, is that, you know, really realizing that physical activity is a key part of public health,
Absolutely.
you know,
Yeah.
Central to it.
You know, I think one of the reasons why, you know, it's become such a problem is we've just so effectively engineered physical activity out of our lifestyle.
Yeah, yeah.
You know?
More and more things, the labor saving.
Yes, exactly. But you know, but it's that accumulation of activity throughout the day. You know, even once we became more industrialized, still was keeping us healthy. You know, as Jim Levine would say, it's kind of your non-exercise activity thermogenesis. But you know, whether we're at home, you know, or we're at the workplace, you know, we've created all of these, you know, systems, tools, and strategies to help us sit more.
I need to move on, but please tell me about your treadmill desk.
So I have a Trek desk, and it's a freestanding desk that sits over a treadmill or stands over a treadmill, and it allows me to walk all day long. And in a typical day, I walk 5 to 6 miles.
Wow.
At 1.2 miles per hour.
Now, are these readily available to purchase, or
Yeah,
how?
you can. You can go to trekdesk.com and
Okay.
Amazon.
We didn't mean to have a commercial
Yeah,
here, but-
exactly, exactly. And I receive no royalties from this.
Yeah, let's make that
Yeah.
clear.
But I just think it's such a wonderful concept.
Yeah,
I
it
mean,
sure is,
and I have found, I've been doing this for about 2 years now, and you know, I feel so much better. I have more energy. I can concentrate better. I can very easily type and do my emails and write and read and talk on the phone and, you know, all the things that we do in our normal day.
Yeah, that's very exciting.
Now, I only sit if I have to.
You're right.
You know, in
Like
meetings.
now.
Or, you know, I sit when I eat lunch.
Well, before we run out of time, all this is so exciting, I need to get a little bit back to ACSM again. You've done many, many things for ACSM, and I just wanted to try to touch on some things. You know, you became a fellow, board of trustees,
Yep.
right up through. When did you become a fellow? Do you remember?
Boy.
This isn't a test.
Yeah.
Sort of a guess is okay, but
I
just
think
to-
I became a fellow in maybe 96 or 97.
Okay.
Yeah, somewhere around there.
And then were you on committees besides the physician's course, I guess?
So I was the chair of the Strategic Health Initiative for Women's Sport and Physical Activity. I think that was the first committee I chaired. First committee I was on, first committee I chaired. And then, you know, I've been on a number of committees, you know, since then. You know, the Exhibits Advisory Committee and, oh gosh, what else?
Well,
know,
you've been directly involved with the Exercises Medicine
Yes, and
campaign and the American Fitness Index. Or
True, I'm on both of those.
So those things.
And so for Exercises Medicine, I chair the practice committee, and I'm on the pediatrics committee, and I'm on the Exercises
Too
Medicine
many committees to remember them all.
advisory committee. And of course, you know, I've been a board member and am now one of the clinical vice presidents.
Right, right. So it's you and who's the other VP? Ben?
Ben Levine.
Yeah,
Yep.
yeah, okay.
Yeah. So, and we are great friends, and we met back in, I think, 1992 when we served on a panel, a case presentation panel together. And so I count him as one of my very dear friends. And
Yeah.
you know, that's the thing about ECSM is that, you know, I love coming to these meetings, you know, to learn and to contribute. you know, equally as important really is the friendships that,
yeah.
you know, I have made. And, you know, I so look forward to coming here and seeing people. And, you know, we've become such good friends over time that, you know, now we look for other opportunities to see one another. And, you know, ultimately, I really think that that's what I get out of ACSM the most, are those personal relationships.
Yeah, that was, I'm glad we got that in, because I sort of wanted to end with that. But somebody told me about a book that you were doing, or maybe it's finished, on billing and how to charge for physical activity counseling or something like that. Is that, am I off?
Well, I wrote an article on how to. I wrote an article on billing and coding for physical activity promotion.
Because that's been a big issue.
Right.
Of
it is.
how do you charge for this, or
exactly.
how do you?
And I think that, you know, there's obviously going to be a great deal of evolution there, because with healthcare reform, you know, we're going to see different models of healthcare delivery.
Yeah, for sure.
And I think that, you know, ultimately, you know, we need to go to a system that focuses on cost containment, you know, and less so perhaps on how much revenue can we generate. Because, you know, that doesn't, you know, really achieve the overall goal of lowering costs while still, you know, providing high quality care.
Look at it.
And so right now, in a fee-for-service situation, you need to have a mechanism, you know, to bill for what you do.
Right.
But ultimately, I think we're going to have, you know, systems that, you know, where you have more managed care, the patient-centered medical home movement, accountable care organizations, things like that are going to hopefully help us contain costs, but at the same time expand services. And I'm glad I don't have to figure that out. But within that setting, I think that's where I hope that we can integrate, you know, health and fitness professionals, you know, into the patient-centered medical home, certified exercise physiologists, nutritionists, you know, people who have the knowledge, they have the expertise, and probably the time, you know, to be much more effective in partnering with physicians and patients to improve lifestyle.
So money saved is money earned.
That's right. Absolutely.
Yeah.
And I really hope that the work we're doing now gets integrated into some of those models in a way so that we can be more effective in delivering, you know, that type of messaging to patients.
Well, you know, what you're doing there in Salt Lake now, and what Rosemary's starting to do, could be the models.
I think so,
you know,
too.
That could really be the change.
And there are others, you know, that I think have already had some demonstrable success. You know, Nico Pronk and his work.
Oh, I've met him.
You know,
yeah.
at Health Partners, and you know, and Group Health is leading the way. I think the work they've done in Kaiser. But keep in mind, these are all integrated healthcare systems.
Yes. Yeah.
You know, and I think that in terms of a model of healthcare delivery, you know, that is sustainable.
It's working.
Is working.
Yeah.
Yeah, and I think we're going to see more growth in those areas, and that's where we really need to, I think, invest our dollars and focus our efforts to improve the health of populations, you know, while also delivering one-on-one care.
Just to sort of conclude, and I ask everyone this, where is ACSM now? Do you think things are going well? Any changes? Sort of a big global, you know, are we trying to do too much? You know, what do you see looking at this now for quite a long time, and as a college?
Well, you know, I was at the business meeting yesterday when they announced that we had over 21,000 members.
Yeah.
And this is the highest attended meeting ever, with more than 6,000 attendees, you know, which is just phenomenal.
That's huge, yeah.
And, you know, I have a little sense of pride for that, you know, that, you know, we have, you know, the collective we have, you know, created an organization that, you know, is meaningful, you know, to people, you know, in terms of joining it and attending the meetings. That, you know, is large enough to make a difference, you know, on a very large, on a worldwide scale.
On a policy level,
yes,
for
at a
sure.
policy level.
Yeah.
And that, you know, clearly with that type of growth, you know, it's meeting the needs of its various constituents in exercise science, in education, in health and fitness, and in clinical sports medicine.
Yeah.
And so I think that, you know, we're doing exceptionally well as an organization. And, you know, ACSM's strength is its multidisciplinary approach and integrative approach.
Yes.
And
Yeah.
I think that, you know, that's definitely the direction we need to go in, you know, to like I said, to make a difference. So
Yeah.
I see the direction that ACSM is moving in as very positive.
The right thing at the right time.
Absolutely.
Yeah.
Yeah.
Well, thank you, Liz,
Yeah,
very
my
much.
pleasure.
I appreciate it.
Yeah.
Time goes way too fast.
It does.